Hi, welcome back to this series on professional exams made easy. We were discussing about a lot of important topics which are very frequently asked in first MBBS university exams. We have covered most of the gross anatomy topics, and in the last session, we had discussed about some of the important short essays that come from general embryology. In this session, let's focus on the questions which are frequently asked from systemic embryology. In most of the universities, systemic embryology comes in paper 2. In some of the universities, related embryology is asked often together. For example, when we talk about RGHS, let's take for example, usually paper 1 contains the thorax as well as the head and neck. So development of thorax, for example, development of heart, development of lungs frequently is asked in paper 1, right? When it is about abdomen, pelvis, the development of these organs are asked in paper 2. So development of thorax, development of head and neck, pharyngeal apparatus. These are the topics you need to be prepared for, like both the papers. Okay. Invariably, the development is asked along with the main organ, but there could be slight overlapping of these topics. So let's get started with the most frequently asked questions in systemic embryology. And we will also discuss about two of the most important questions, which are like very frequently asked from systemic embryology, right? And we will see how exactly to answer these questions. First, let's start with what are the important questions that are asked in the development of pharyngeal apparatus. As I said, in some of the universities, this could come in paper 1, where we ask the questions related to gross anatomy of head and neck, right? Otherwise, this could come in paper 2. Doesn't matter, better to be prepared for both the papers, right? So first, let's see what questions come from this topic. So usually questions from this topic, even if it's a short essay or a short answer or even MCQ, it is always on what are the derivatives, right? What exactly are the derivatives of first pharyngeal arch, second, third, fourth, sixth arch, like this, right? When they ask about pharyngeal apparatus, we need to be very careful about the terminologies they use. First is the term pharyngeal apparatus, then the term like arches, pouches, cleft, and membrane. Remember, pharyngeal apparatus is a collective term which includes everything, right? Uh, Arches, pouches, clefts, and membrane. If they specifically ask about arches, we need to remember when we say pharyngeal arches, we refer to the mesoderm, the mesodermal component. And in the mesodermal component, we need to list down in the form of a tabular column, prepare a table showing what are the derivatives of the cartilage, then what are the derivatives of or the muscular derivatives, what are the nerves supplying them. Okay, these are the main things that we need to discuss when we talk about pharyngeal arches. You might be wondering what happened to the arteries. We will take up arteries separately. Are we clear? So in pharyngeal arches, these are the terms that we will discuss. The pharyngeal arch mesoderm, what are the derivatives from the pharyngeal arch mesoderm, right? Then what about pharyngeal pouches? Remember, in pharyngeal pouches, we need to discuss the derivatives of the endoderm, right? So we need to discuss the derivatives of the first pharyngeal pouch, second, third, and the fourth pharyngeal pouch, right? What happens to the dorsal wing? What happens to the ventral wing? This is what we need to answer in case of pharyngeal pouches. Remember again, these are not only asked as 3-marker questions, but these are very frequently asked as MCQ question. Now, just to give you an example, let's say we are talking about the third pharyngeal pouch, right? The third pharyngeal pouch has a ventral wing, right? And it has a dorsal wing. Now, what structure comes from the ventral wing? Remember, ventral wing will give rise to the rudiment of the thymus. the development of the thymus comes from the ventral wing, whereas the dorsal wing gives rise to the inferior parathyroid. So to this detail, we must know the derivatives of the pouches. Are we clear? Right. Then what about cleft? Remember, whenever we use the term cleft, we are referring only to ectoderm. Fortunately, we need to mention about the derivative from the first pharyngeal cleft, which is the external acoustic meatus. Nothing else develops from this, right? Whereas arches and pouches, we need to remember for the 4 or the 5 arches and the pouches, right? If you can make your own table of derivatives of pharyngeal arches, that is all that is needed to solve every question that is asked from this topic, right? Then what about pharyngeal membrane? Now, pharyngeal membrane is a peculiar structure, right? If we say this is the pharyngeal arches, right? So this is how the pharyngeal arches look, right? So inside we have the endoderm, which will give rise to pouches. Then outside we have the ectoderm, which will give rise to cleft. Then inside we have the mesoderm, right? At one point where the ectoderm, endoderm, and the mesoderm, all of them lie together, this area is what we call as pharyngeal membrane. And we need to remember about only one pharyngeal membrane that exists between the first arch and the second arch, which give rise to, yes, the tympanic membrane. Tympanic membrane, remember, is the only structure that develops from 3 germ layers, ectoderm, endoderm, and mesoderm, and this is how it develops, right? So this is what we need to remember for pharyngeal membrane. Then the pharyngeal arch arteries. What is the fate of the first, second arch artery? We know that first arch artery, second arch artery are rudimentary. They persist in adult life as small remnants in terms of maxillary artery, then stapedial and keraticotympanic artery, right? But what are the derivatives of the third, fourth, and the sixth arch arteries? We need to know. Third arch artery, the common carotid vessels. Fourth arch artery, on the right side, the right subclavian, on the left side, arch of aorta. The development of sixth arch artery, right? This is what is most important for us. Okay. Now, just to give you the example, right? So let's imagine we have the ventral aorta and let's say we have the dorsal aorta on both the sides, right? So we have these pharyngeal arch arteries, which are arranged in, let's say, 6 pairs, right? Let's talk about the 6th pair. So let's imagine this is the 6th pair arch artery, right? Now, what happens to the distal part? What happens to the proximal part is very important. On the right side and the left side, the proximal part, right? This part develops into pulmonary arteries. So right and left proximal 6th arch artery will give rise to what? The right and left pulmonary artery. But what is the fate of the distal part? The distal part on the right side disappears. Okay. So the distal part on the right side disappears. Whereas on the left side, this persists as the ductus arteriosus, which later becomes ligamentum arteriosum. This is one of the reasons why the recurrent laryngeal nerve on the right side, as it arises from the vagus, hooks around the 4th arch artery, which will give rise to the right subclavian. Whereas on the left side, it hooks around the ligamentum arteriosum ultimately. Now, this is a question you will be definitely asked in your embryology Viva, right? Pharyngeal apparatus is like very favorite topic for examiners. Okay. And since this is considered easy and most of the students prepare for this topic, this is one area where the examiner will try to catch you, right? The development of pharyngeal arch arteries, right? Especially the fate of the 6th arch artery. Are we clear? Right. So this is regarding the pharyngeal apparatus. In this, one developmental abnormality they can usually ask is cervical sinus, right? what they can ask you is, what is the embryological basis or developmental basis of cervical sinus or cervical fistula? Why does cervical sinus form or cervical fistula form? What is the embryological basis? This could be a very important 3-marker question, right? As I told, the pharyngeal apparatus is one of the favorite topic of examiners. So this is one topic in embryology that you must never skip, right? Done. Then the next important thing is the development of tongue and thyroid. Now remember, both of these are 5-marker questions, or there could be 3-marker questions, or there could be MCQs, right? Questions for 10 markers or 15 markers in embryology is very rare. I think I have told this earlier in my class. Only once in UG paper, I think this was in RGHS, where we had seen development of respiratory system as a main question. Rarest of the rarest possibilities, right? But these two topics, even in these two topics, I would put my money on the development of the tongue. Every question paper, let it be of any university in the country, will have one question on either anatomy of the tongue, histology of the tongue, or development of the tongue, right? So such a high yield chapter. That's why we will discuss the development of the tongue in the end of the class, right? We will discuss how to write the development of the tongue. Even though it is very commonly asked, we as students would make a few mistakes which would deprive us of important marks. Now, how to ensure that we score all of them, we will try to discuss it by the end of the class. Okay, how to write a short essay on development of the tongue. Development of the thyroid, again, as I said, is an important 5-marker or 3-marker question. Done. In the development of the thyroid, one thing the examiner would look for, right? We would all describe the development of the thyroid coming from the thyroglossal duct, from the foramen cecum. We will explain the development, everything. But what do we usually forget in development of the thyroid is the development of the parafollicular cells, right? The entire thyroid is a derivative of endoderm, right? Thyroglossal duct. But parafollicular cells, remember, these are derivative of the neural crest cells, right? And as an evaluator, this is what we look for. Okay, any evaluator would look for whether you have written the development of the parafollicular cells along with the thyroid, right? Done. Then the next important chapter in the systemic embryology, I would say, is the development of face, nose, and palate. Okay, now here what questions we usually get is, we get the short essay on development of the face, then development of the palate, and as well as the abnormalities of the face, right? In face, what we need to write, okay, if asked, I'm just giving an example, right? Development of the face, the first thing that we need to do again is talk about timeline. Remember, every organ that you describe in embryology should have timeline to go with it. When exactly development of this organ, this structure, this should be mentioned clearly, right? So first thing is, when does development of the face occurs? Then the sources. What are the 3 facial processes? Frontonasal, maxillary, and mandibular. What are these processes? What are the derivatives of each of these processes? And when these processes do not fuse, what happens? So sources and its derivatives, right? And then the developmental abnormality. Developmental abnormalities in terms of cleft lip, right? And then cleft palate, right? What do we mean by cleft lip? What do we mean by cleft palate? What is the embryological basis behind cleft lip and cleft palate? What are the types? For example, what is median cleft lip? What is unilateral? What is bilateral cleft lip? What is the embryological abnormality behind these? This is what we must know. right? Then cleft palate, what are the different types? What do we mean by complete cleft lip? What do we mean by unilateral cleft palate? What do we mean by complete cleft palate? What is the embryological basis behind this? This we must know. Then these two again are very commonly kept embryology models. So very often we think that embryology is important only for theory, right? And that's why we most of the time ignore, because like every university keeps about like 8 marks at maximum or 10 in some cases. But remember, this comes in handy even in your spotter exams where they keep embryology models. Then they also keep your embryology Viva station where you need to describe a model, right? So that is why we must know thoroughly these topics. Done? Right. So this is regarding the next important topic. Then the development of digestive system. Now in development of digestive system, the most important question that is asked, let's say, is the rotation of the midgut. Okay. This is an important 5-marker, midgut rotation, whereas derivatives are 3-marker questions or MCQs, where you need to know what are the structures that come from foregut, what are the structures that come from midgut, and what are the structures of the GIT that comes from hindgut. Here, I want you to know about two important terms. One is the anterior intestinal portal, and the other one is the posterior intestinal portal. Now, what exactly are these two terms? Right? Remember, anterior intestinal portal represents the junction of the foregut and the midgut. Right? What is this represented in adult life? Remember, it is the major duodenal papilla seen in second part of duodenum. Right? So this represents the junction of the foregut and the midgut. Are we clear? Then, what is posterior intestinal portal? This is the junction of midgut and hindgut. And what is this represented in adult life? The junction of right 2/3 and left 1/3 of the transverse colon. Right? This is very important in order to understand the developmental basis for the blood supply of the entire GIT. For example, above the major duodenal papilla, whatever structures you have, for example, the stomach, the first part of the duodenum and the upper half of second part, these parts are supplied by the celiac trunk, which is the artery of the foregut. Midgut, when we talk, gives rise to the second part of the duodenum below the level of major duodenal papilla till right 2/3 of the transverse colon. So majority of the intestines, including duodenum, jejunum, ileum, cecum appendix, then ascending colon, right 2/3 of the transverse colon, all of this, right? Majority of the intestine is supplied by the superior mesenteric artery, which is also called as the artery of the midgut. Similarly, beyond the left 1/3 of the transverse colon till the anal canal, right? Above the pectinate line, we have the inferior mesenteric artery that supplies it, which is also called as the artery of the hindgut. So if we know these definitions, these concepts, we can apply this to the blood supply of the GIT, right? Any point of time, you cannot solve an MCQ, right? You cannot recall a blood vessel. Think of this, right? What part of the GIT comes from foregut, midgut, and hindgut, and what artery supplies it. This is how you should approach solving the question. Right? Done. Then these two are either 3-marker questions, but very often asked as MCQ questions, right? Omphalocele and gastroschisis. These two are also kept as spotter questions in your gross anatomy practical exam. A model of omphalocele or a specimen of omphalocele or gastroschisis can be kept, and you can be asked about what is the embryological basis. Let it be any abnormality. The only thing they will ask you is why this occurs. What is the embryological basis behind this developmental abnormality? This is what will be asked. Are we clear? Right. Then the next thing is with respect to development of pancreas. This is a very important 5-marker. Apart from the midgut rotation, Development of the pancreas is one question which is very frequently asked in the exams, right? As with the development of the tongue, which is very frequently asked in paper one, the development of the pancreas is very frequently asked in paper two, right? So this is one topic that you need to be prepared for. And this is also important for your embryology viva, right? This model almost all the medical students will know, right? When we go as external examiners, when sometimes we do give the students pick a model that you want to describe or explain. There are two embryology models that are like very often picked, right? One is the development of the tongue, and the other one is the development of the pancreas. Okay, these are the two models that every student will know, right? So beyond this, you should know the models. Okay, we will not be lucky always. We will not be given chance to pick models, right? Even we are given a chance, since the evaluator would be fed up with listening to development of the tongue and pancreas, they would definitely ask something else. Fine. So development of the pancreas is something that you should know. On the other hand, let's imagine you are not able to answer even development of the tongue or pancreas, which is considered as like the most easiest of the embryology models to explain. Then I would say you are in trouble. Okay, with respect to your embryology station. Fine. So these are the two models that you need to be prepared for very well. Then the derivatives of the mesogastrium. This question we are seeing very frequently as MCQ question. Okay. So what happens with the mesogastrium is there is a ventral mesogastrium, there is stomach, there is dorsal mesogastrium. What are the structures derived from ventral mesogastrium? What are the structures that develop from dorsal mesogastrium? Right. This question is very frequently asked as MCQ. Then in your gross anatomy spotter, sometimes they'll mark the falciform ligament or the lesser omentum or the greater omentum or even the gastrosplenic ligament, and they'll ask you, what is the embryological development? What is the embryological source? For that, we must know what are the derivatives of the mesogastrium. So this could be an MCQ question, or this could be an important 3-marker question. Are we clear? So this is regarding the important topics we should know from the digestive system. Right. Then the next important thing is development of respiratory system. In this, if a question comes, it is a 5-marker, and they would ask specifically about what are the 4 stages of maturation of the lung. Right. As I said, only once in recent times, not in recent times also, I think this was in late probably 2017, 18 or something like that. This question had come once, okay, in RGHS as I mentioned. Otherwise, you get 5-marker question where you should know about the stages of maturation of the tongue, the lungs, right? Then the development of the CVS is one topic again where a lot of important 5 markers come, and these 5 markers are isolated 5 markers or often a part of the long essay, right? Usually the normal question, let's say, is describe the internal features of the right atrium. Then add a note on the development of the interatrial septum or the right atrium. Okay, but development of interatrial septum and the development of interventricular septum, these are important 5-marker questions. Okay, very often asked even in your embryology viva as well as in your theory exam. So these are the 2 topics that you need to be prepared for 5-marker questions. Done? Right. Then derivatives of heart tube. This could be a 3-marker question or could be an MCQ. Right? If the examiner wants to make the question and your life little bit easy, they can ask, list the derivatives of the parts of the primitive heart tube. So you need to write the subdivisions of the heart tube and what chamber of the heart or what artery comes from that particular part of the heart tube. Right? Then development of inferior vena cava. we have not seen questions per se recently, but this could be an important bouncer for you, right? Usually one or two questions in every paper is like that will not be able to attempt. So if we can expect a bouncer, let's say from systemic embryology, I would say this would be from development of inferior vena cava. Okay, so this is one topic that we need to be prepared with. Development of inferior vena cava. Then fetal circulation again is an important 5 marker. This is an important embryology model that we need to be discussed. We need to be prepared for the Viva, right? Fetal circulation, remember, you should be able to describe it in terms of 3 embryonic shunts. So if you are good at diagram, draw a diagram. If not diagram, at least make sure that you show the entire fetal circulation using a flow chart where ensure that you show 3 shunts. Fine. Can someone tell me what are these 3 shunts? Fine. Those who are in the session, can you just let me know what are these 3 shunts? Right? Fine. So remember, how many shunts we have? 3. What are these 3 shunts? These 3 shunts begin with the ductus venosus. First shunt, right? What is the next shunt we have? The next shunt we have is foramen ovale, and the third shunt we have is the ductus arteriosus. Right? So these are the 3 shunts, and we need to mention about how these shunts will divert the blood in fetal circulation. Then, remember, there is a clear-cut difference between the term fetal circulation and neonatal circulation, right? So, whenever we say neonatal circulation, in neonatal circulation, we need to explain the changes that occur after the birth, right? So, what happens with the first breath or the first cry? How the shunts get closed? When does physiological closure occur? When does anatomical closure occur? Okay, for all these 3, we need to know the time of physiological closure, then anatomical closure, and then what do they persist as? Like ductus venosus, ligamentum venosum, foramen ovale, fossa ovalis, ductus arteriosus, ligamentum arteriosum. This is what we need to know with respect to neonatal circulation. So please do not get confused with these 2 terms. Neonatal circulation, remember, is after birth. Fetal circulation is before birth. So neonatal circulation is as good as adult circulation. But fetal circulation is the one that you should know thoroughly. Are we clear? As I said, if you can draw a diagram, nothing like it. But if not able to draw a diagram, then at least a flow chart. Are we clear? Right. Then the next important chapter is the urinary system. In urinary system, the development of the kidneys is an important 5-marker question. Right? In development of the kidney, how do we describe it? I'm just giving you an example. Start with the timeline. When exactly the development of the kidneys began. Then a slight description of the evolution of the kidney. As we know, kidney develop in 3 stages. What are they? Pronephros, then we have mesonephros, and then we have metanephros. So this need to be mentioned. But remember, when we describe the development of the metanephros, that is when we actually talk about the development of the kidneys. And how do we structure this? Remember, we divide it into the excretory part, right? Or this is the collecting part, right? So excretory part and let's say the collecting part. So we need to talk about the development of the nephron and then the collecting system. How exactly these two parts of the kidney develop, right? From the metanephros, this we need to explain. Then, ideally, you should close it with developmental abnormalities. This itself is an important three-marker question. But once we describe or explain the development of the kidneys, we must be in a position to explain few of the congenital abnormalities. For example, the adult polycystic kidney disease, right? One important congenital abnormality, the horseshoe-shaped kidney where the lower poles get united, pancake kidney where both upper pole and lower pole get united, agenesis of the kidney, right? All this can be mentioned. Fine. One more topic that we often forget when we discuss about development of the kidney is the ascent of the kidneys, right? When we describe the development of the kidney, we describe everything. But remember, very often we tend to neglect the ascent of the kidney. Now, this is one subheading that can give you an edge over others. Not many students would have discussed the ascent of the kidney. This is where you can score, right? So add a note on how the kidneys ascend. Kidneys develop in the pelvic region and then they ascend to the lumbar region. Why does the right kidney is at a lower level compared to the left kidney, right? All this, if you mention, this carries, let's say, a good impression on your evaluator, paper evaluator, and this will carry for other questions also. But make sure you highlight it and this is seen by the examiner. Done? Then, in the urinary system, one more question that is often asked is the development of urinary bladder. Okay? In urinary bladder, one more thing that you should know is what is the developmental importance of the trigone of the bladder. The entire urinary bladder, let's say, is a derivative of, the entire urinary bladder is a derivative of the endodermal cloaca. Cloaca, I will describe what exactly is cloaca a little bit, right? So it comes from the endodermal cloaca, which forms the urogenital sinus, right? There is a vesicourethral part, there is a definitive urogenital sinus, all this. But majority of the urinary bladder comes from the endodermal cloaca, whereas the trigone of the urinary bladder comes from the absorbed part of mesonephric ducts. Because of this embryological peculiarity, this is very often asked as a sub question in your gross anatomy. When they ask about development, the gross anatomy of the urinary bladder, they would ask you to describe the trigone of the bladder and its developmental importance, right? For this, we must know what is the development of the urinary bladder, particularly the trigone. Are we clear? Right. Now, we were talking about cloaca, right? Now, what exactly is cloaca? Remember, when we talk about the gut, we have the foregut, then we have the midgut loop, and then we have the hindgut, right? Now, the hindgut, let's say here we have a diverticulum called as allantoic diverticulum, which comes, right? Now, the post-allantoic part of the hindgut, okay? So to be more specific, the post-allantoic part of the hindgut, this is what we call as the cloaca. The cloaca will divide into an anterior part, the primitive urogenital sinus, which will give rise to a vesicourethral part that develops into bladder and the proximal part of the urethra. Then the definitive urogenital sinus, which gives rise to the further urethral development, right? Whereas the primitive rectum develops into the rectum and anal canal above the pectinate line. So this cloaca again could be a very important 5-marker question or 3-marker question for you, right? So what we need to do here is we need to define what is cloaca, how the cloaca is formed, what are the subdivisions, and what are the derivatives, right? This is what we need to do for the cloaca. Right? Done. Then, okay, once we have learned about the urinary system, the last thing is with respect to the genital system. Right? Now, in the genital system, we need to know about the development of the testis, a very important question. So, in the entire systemic embryology, if you ask me, sir, pick few questions which are like definitely asked, like there are more chances of this being asked, I would put my money on development of the testis, development of the right atrium and interatrial septum, development of tongue, development of pancreas, midgut rotation, right? These are the topics which are often asked when we talk about the development of the CVS, digestive system, or the head and neck region, or the genital system. Development of the testis, descent of the testis. Any exam cannot go without questions on this topic, right? So development of the testis, we'll try to discuss how do we describe if development of the testis is asked in exam. Then development of the uterus could be an important 5-marker or a 3-marker question, right? But most often when we talk about gonads, development of the testis is often asked. When we talk about development of genital ducts, that is the mesonephric duct and the paramesonephric duct, what is usually asked is, what are the derivatives of mesonephric duct and paramesonephric duct? What are the developmental abnormalities? Right? These are the questions that are often asked from the genital system. Right? Now, apart from this, the development of nervous system, we need to know about what are the derivatives of the neural tube. What happens to the cranial end of the neural tube, the caudal end of the neural tube? What are the 3 brain vesicles? What are the structures derived from the 3 brain vesicles? What is prosencephalon, mesencephalon, rhombencephalon? All this we must know, derivatives, right? So development of the CNS, I would say you can get 3-marker question, or let's say you will get a lot of MCQs from this. Okay. Every derivative of the guts, derivative of the genital ducts, then derivative of the neural tube. These are like evaluator or paper setter's favorite questions for making a lot of MCQs. Right? So you must know what are the derivatives of prosencephalon, mesencephalon, rhombencephalon. What are the primary brain vesicles? What are the secondary brain vesicles? How do ventricles develop from the cavity of these vesicles? This is what you must know. But do not invest much time except for knowing what exactly are the derivatives that come from these brain vesicles. Are we clear? Right. Once we have learned about these important short essays which are frequently asked in systemic embryology, there are 2 questions I said which are like high yield topics, right? One is the development of the tongue and the other one is the development of the testis. If these 2 questions come, how do we answer these 2 questions, right? Again, always start with the timeline. Remember, the development of the head and neck region predominantly occurs at around 5 weeks. Okay, this you can remember. Development of the tongue begins in the later part of the 4th week and the early part of the 5th week. Right? This should be the first line. Then the development of the tongue need to be discussed under these 3 headings. Right? Once we get the question on development of the tongue, we will feel that, okay, like here are 5 marks for taking. But remember, we need to structure our answer to get all those 5 marks. We can get all the 5 marks, right? But if you can structure your answer like this, right? Remember, the development of the tongue need to be described under development of the mucosa, development of the connective tissue, and development of the muscles. Development of the muscles is simple. All we need to write is this comes from the occipital myotomes, right? Occipital myotomes. Then connective tissue comes from the mesoderm of the head and neck or mesenchyme of the head and neck. What about mucosa? Now here what we need to explain, right? So what do we have? We have 2 lingual swellings, we have a tuberculum impar, and then we have the hypobronchial eminence. How this gives rise to the anterior two-third of the tongue, right? Then posterior one-third of the tongue and posterior most part of the tongue. This is what we need to explain, right? So show the derivatives of the tongue, like how exactly these come from different parts. This is what we need to describe in the mucosa. So whenever we talk about lingual swellings, tuberculum impar, or even the posterior part, the hypobronchial eminence, remember, these give rise to only mucosa of the tongue. They do not give rise to connective tissue. They do not give rise to muscles. And this is what the examiner would be looking at, right? Have you described the answer under these headings, right? Once you have written this, my suggestion, follow it up with correlation with its nerve supply, right? This can come as describe the nerve supply of the tongue with its embryological correlation, or they can ask you about development of the tongue and ask you to correlate it with its nerve supply. Now, what is the correlation that they expect? Since muscles develop from occipital myotomes, this is innervated by hypoglossal nerve, right? Since the anterior two-thirds of the tongue mainly comes from the lingual swelling and the tuberculum impar, which comes from the first arch, it is innervated by the lingual nerve. The second arch component gets buried deeper. That is why the facial nerve does not directly supply any part of the tongue. The chorda tympani will carry taste sensation from the anterior two-thirds of the tongue, but it has to depend on lingual nerve, right? Then what happens to the posterior one-third of the tongue? It comes from what? The hypobronchial eminence, right? Then posterior most part of the tongue, caudal part of the hypobronchial eminence, which are derived respectively from the third and the fourth arch, hence innervated by glossopharyngeal nerve and the vagus nerve, right? This is what we need to write. Very often, one more question that is asked is the circumvallate papilla of the tongue, right? What is the nerve supply of circumvallate papilla of the tongue? Even though the circumvallate papilla are present in the anterior two-thirds, remember, it is innervated by what? The glossopharyngeal nerve. And why? That is because of the embryological reason. Even though present in front of the sulcus terminalis, the circumvallate papilla comes from the third pharyngeal arch. That is why it is innervated by the nerve of the third arch, that is glossopharyngeal nerve. Are we clear? Right. This is what we need to describe in development of the tongue. Done? Then developmental abnormalities. Okay. Of course, one developmental abnormality I want all of you to write as ankyloglossia, right? The tongue tie, right? Where the frenulum of the tongue is short. Then microglossia, macroglossia, bifid tongue, all of this you can mention as the developmental abnormalities. Okay. But remember, if I'm asked to pick one question in this entire session that we are discussing, right? I would put all my money on this development of the tongue. So this is one topic that you should be prepared with thoroughly, right? Are we clear? Done. So apart from the development of the tongue, one more question that is very frequently asked is development of the testis. A very important 5-marker question, could be a big part of a long essay. Remember, there is nothing much to describe in the gross anatomy of the testis, except for little bit on its arterial supply, venous drainage, lymphatic drainage. External features, it is limited, right? Other than that, the macroscopic structure in cut section. So even as a part of long essay, they can ask about development and descent of the testis. So if asked, this is how we need to begin. Development of the gonads begin as early as 4th week of development. The development of the gonads occur in 2 definitive stages. One is called as the stage of indifferent gonads, the stage of the definitive gonad. I'm sorry for the typo. This is called as the definitive stage, right? Stage of definitive gonadal development, right? Where we need to discuss about the development of the testis or the ovary in particular, right? So first thing before we talk about development is, what are the three embryological sources from which testis develops? For example, the development of the testis, one comes from the intermediate mesoderm. As we know, the intermediate mesoderm is responsible for giving rise to the entire urogenital system. Then the second thing is the coelomic epithelium. Coelomic epithelium that lines the body cavities. Then the third thing is the primordial germ cells. This is a must again. Once you list this, then go for development of indifferent stage and the definitive stage. In indifferent stage, what do we mention? In indifferent stage, we talk about migration of the cells. For example, let's imagine this is the yolk sac, right? The yolk sac is covered by the dorsal mesentery, and this actually lines the body wall, which shows two ridges, right? The medial ridge is called as the genital ridge. The lateral ridge is called as the urinary or the nephrogenic ridge, right? What happens is the cells migrate to the genital ridge, okay, from the endoderm of the yolk sac, where we have the developing gonads. So these cells migrate into developing gonads, right? So these are the primordial germ cells. Then this ridge is lined by the coelomic epithelium. The coelomic epithelium will also migrate into the developing gonads to give rise to the cells of the gonads. So this is what will happen in the indifferent stage. What happens in definitive stage? In the definitive stage, in presence of SRY gene, right? What happens is we have the early gonad, which will have two distinct regions. One is the cortex and the other one is the medulla. In presence of SRY gene, the cortex will regress, whereas the medulla will develop into testis. In the absence of SRY gene, the cortex develop into ovary and the medulla regresses. This is what we need to explain in the definitive stage. How does the medulla give rise to sex cords? These sex cords anastomose in rete testis and become horseshoe shaped, gets canalized and form the seminiferous tubules. That is what we need to explain in definitive stage, right? Then one more important topic that we need to discuss in development of the testis is how exactly the testis descends. In descent of the testis, what is important is, first, what are the factors that regulate the descent? Then, why does testis descend? And then, what is the timeline of descent? When does it reach the deep inguinal ring? When it reaches the inguinal canal? When it reaches the superficial inguinal ring? When does it reach the scrotum? This is what we need to mention in descent of the testis. Why descent of the testis occurs? Because the testis needs to be kept at a temperature of about 2 degrees centigrade below the core body temperature. What are the factors that regulate it? It starts with the differential growth of the posterior abdominal wall, the processus vaginalis, the gubernaculum testis, and then we have the male hormones, differential growth of the body wall. All these need to be listed one by one, briefly explained for the descent of the testis. Then we need to talk about timeline. When does it reach the superficial ring? Sorry, deep inguinal ring? When does it traverse the inguinal canal? When does it come to superficial inguinal ring? And when does it come to scrotum? After this, we need to talk about developmental abnormalities. And developmental abnormalities, remember, what do we need to remember? The cryptorchidism, right? What do we mean by cryptorchidism? How this is different from the ectopic testis, right? A cryptorchidism is just hidden testis. Ectopic testis, like presence of the testis in different locations than the normal pathway of descent, right? So these two terms you need to explain and differentiate, and also mention the embryological basis, right? So this is how we need to describe about the development of the testis. Are we clear? Right? So what we did today is we have listed uh, questions which can come from possible questions which can come from systemic embryology, and we tried to discuss about if development of the tongue is asked or the development of the testis is asked, how to describe the answer, how to explain, how to structure the answer. Fine. This is how you should describe and write or present your answers in the exams. Okay. I'll repeat again. The way you present your answers has a lot of weightage. I'll keep repeating. Almost all the evaluators are likely to spend about 2 to 3 minutes in evaluating your paper. In those 2 to 3 minutes, you need to convince your evaluator that you have written everything. How do you do it? By presenting your answers well, right? Presentation always matters. Your paper could have everything that is given in the textbook, but if you don't present it well, if you don't structure it in different subheadings, there are greater chances that you will lose marks, right? So please practice and present your answers in a structured manner in your exams, and believe me, you will definitely score well, right? So this is regarding some of the embryology topics that I wanted to discuss. If there are any doubts before we close, please do ask. We will come up with few more questions on Thursday, and we shall discuss these questions, right? If there are any doubts, please do let me know. Yeah. So I thank all of you for joining this session, and I wish you all the best for your preparation and for the upcoming exams. We'll meet again on Thursday. Thank you.